Well, we all know how important sleep is when it comes to our brain, but what about our heart? Travis Schlenger of Cass Regional Medical Center Sleep Lab joins us this morning, and we said, if you're really good at your job, I should fall asleep by the end of this segment.
Poof.
There
you go.
There goes my head. So we know that this is important, but how do we know when somebody just can't sleep and when somebody has a disorder?
Well, basically, you kind of have to evaluate yourself. And by doing that, what I mean is, during the night, how many times do you wake up to go to the bathroom? Do you wake up tired? Mm-hmm. Do you feel, rested when you wake up? So if you kind of self-evaluate yourself, then you can kind of understand what you're doing. Then you can ask your spouse or bed partner and find out, do I snore? Do I quit breathing at night? Is that something that's also keeping me awake at night?
So you really have to have sort of a baseline to get started to even know what your kind of normal is. Mm-hmm. Before you move on to the other things. First of all, answer the old question, how much sleep should we be getting? I'm sure everybody asks you that all the time.
That is a very common question. And, every year we come out with a new study that says, well, you need 7 hours is optimal, 8 hours is optimal. Well, I got tired of listening to that, so I actually found an article about 6 to 8 months ago that actually talked about that. And it said everybody's a little bit different, and everybody needs a certain amount of sleep. So what you should try to do, and with as busy as our society is, it's really difficult, but you should try to go to bed at 10 o'clock and just sleep until you wake up. And try and get a pattern and see how long you're actually sleeping. Then make an adjustment on the night before. So if you slept in until 9 o'clock the next morning and you need to be up at 6, well, then you need to go to bed at 7 so that you're up at 6 the next morning.
Interesting. So you're adjusting it as you go and figure out that hour for you.
Yep. And it would wax and wane. I mean, soon after you do that, your body will eventually catch up on its sleep and feel more rested, so then you could probably start going to bed a little bit later and then be able to get up at 6 o'clock and feel refreshed and ready for the day. Well,
we got a couple of minutes left, and we have to hit two very important things. First of all, the effect that it has on somebody. I know when it comes to your head, when you're tired, you're irrational, and you're not thinking clearly, and you don't. But how does it affect, like, your heart? That was interesting. How does it affect your heart?
It really affects your heart, because basically what's happening is when you quit breathing at night, then your heart slows down and you're not pumping as much blood around. Right. So then your brain says, hey, I need oxygen up here. So it sends a pulse to your central nervous system and says, hey, get this oxygen pumped out. So then that speeds up your heart. So then, so it can get everything pumped out. Well, then once your brain gets all this oxygen, then it's like, hey, wait a minute, I have too much, slow down. So your heart is constantly up and down all night long, so your heart doesn't get the rest that it needs at night if you quit breathing and have any snoring.
Wow, that's fascinating. So what do you do about this? What can people do to try to make themselves healthier sleepers?
Well, come see me. Come see me. We'll set up a sleep study for you. Right. And basically what we'll do is we'll monitor you for 2 to 3 hours during the first part of the night, and we will see if you do in fact quit breathing or have any shallow breathing, right, what's causing it, and then we'll go ahead and initiate what we call CPAP. It's a continuous positive airway pressure. You wear it on your nose like an oxygen mask, and it blows air in through your nose to keep your airway open so that you breathe properly, as well as quit snoring.
Fascinating.
Yeah.
And this is something that affects so many people, regardless of age and socioeconomic strata and everything. It affects everybody across the board, doesn't it?
It surely does.
I feel very rested right now, though. If you would get off my sofa, I would take a nap right now.
All right, well, I'm out of here.
You can find the Cass Regional Medical Center Sleep Lab online at cassregional.org and learn so much more about this very important topic and make yourself sleep healthy and live healthier. That's fascinating. Thank you so much.
Thanks for having me.